Move on to our federal legislative piece, and we have a couple of speakers from CHIPRA who are going to be doing this overview for us. Our first speaker on the federal legislative update piece is Joseph Villela, and he's going to talk about the State Children's Health Insurance Program. And Joseph is with the Coalition for Humane Immigrant Rights of Los Angeles. Welcome, Joseph.
Thank you for coming in. My name is Joseph Villela, and I'm the state policy advocate for CHIPRA. I will talk a little bit for about 5 minutes about the new law that was implemented by the new administration, which is called the Child Health Improvement Act of 2009, or CHIPRA, and what are some of those implications into our state, specifically immigrant communities. So what CHIPRA? It's a very fun name, but what it does, it pretty much it reauthorized what was called the CHIP program, or in California, the Healthy Families Program. And what it does is that it provides funding for states to cover children's. And this legislation is going to provide funding into the fiscal year of 2013. And I can mention this new law was just enacted in February 4th of this year. And the states can actually get the funding or ask for funding to cover kids starting April 1st. A little bit of background about this legislation. This legislation was first enacted in 1997 and was enacted for about 10 years. Last year there was a big fight to reauthorize this legislation. Unfortunately, our former president, President Bush, vetoed this legislation, which he pretty much argued that this was a step towards socialized medicine. The bill that he vetoed was actually a very watered down legislation than what was actually enacted by the new administration. And so how much funding our states are going to be receiving via this new legislation? They're going to be receiving about $32.3 billion over the next 4.5 years. And the idea behind that funding is that first and foremost, they need to maintain the current children that are covered under this program, but also to expand the health coverage to other children. And obviously, the congressional records indicates that about $32.3 billion are going to be given to states. However, this number does not account for what they call the baseline, or that is the amount of money that states are currently receiving, which is $5 billion, in addition to the increase in revenue or taxation for tobacco, for the tobacco use. This will bring about nearly twice the funding for this program compared to last year. And in total for the 4.5 years, we're going to see about $69 billion for this program, which is a huge advancement towards expanding any health coverage for children. In addition, within that funding, another good item is that we're going to have about $100 million for outreach. So we can enroll new kids. And that outreach, or those grants, are actually going to be emphasizing in certain areas. The first one is that they're going to be emphasizing in underserved population. And some of those funds have to go towards addressing cultural and linguistic barriers for enrollment. Obviously, that's some of the population that some of us represent. In addition to that, if these funds will be eligible, or cities and state agencies can apply for these fundings, but also CBOs who have direct relationships with communities that have some needs in regards to linguistic or cultural assistance when it comes down to enrollment. The way that the application process is going to go about in regards to outreach is that the Secretary of Health and Human Services will be awarding these grants towards either CBOs, state agencies, or local agencies. In addition to that, this money will not only be useful for enrollment, but specifically for language access. Service providers can also apply or use this money to provide health services for those individuals that might need translation when it comes down to accessing those health services in the health services arena, or settings rather. In addition, let me just go back. Let me go. What that means also to California. one of the things that I didn't mention in the last slide is that the legislation also allows for expansion of coverage. Currently, there's a limit in regards to income eligibility for families who want to access this program. This new law would allow families who are above 300% of the federal power line to get into this program. Another thing, kind of like a compromise that came up for us to get that bill done, was that there's going to be a citizenship documentation requirement when it comes down to this program. And it's very similar to the requirements that were enacted under the Budget Deficit Reduction Act in 2006. And so, for instance, anyone that claims citizenship, specifically kids, they will have to run their Social Security numbers with the Social Security Administration database, and that's how you get verified in order to access this program. And so what is the impact in California? As we mentioned, there's the big budget deficit that we have here. This will help California bring new dollars to our general fund, and obviously that will help a little bit. Our state, and hopefully not, our legislature and governor will not be forced to cut some of the programs that we care the most. As some of our presenters mentioned, there was a ban for legal permanent residents to access any public services as well as health services from any program that was funded via federal funding. What this will do is actually take that elimination just for the health arena, specifically for kids. So not kids who are legally residing in in the U.S. And are in California. Our state are actually going to be receiving that money back. And as a background, California was actually, we are, given that demographics are really diverse, California is one of the few states that actually implemented some of the programs that were mentioned by previous presenters, such as the CAPI and the CFAC. In addition to that, we also allow or cover these children with our state dollars. And other 20 states have actually done that also. In addition to providing funding to cover legal permanent residents, this program would also allow pregnant women who are under medical to also be funded via the federal matching funding funds that we're going to get from the federal government. As a background, if any state wanted to cover pregnant women, in the past they had to apply for a waiver with the federal government to get that done. This law, what it will do is that it will allow the states to make any changes under the new law. They will be able to do so through a state plans amendment. So that means that they will not have to apply to the federal government and not go through any bureaucracy that might slow down the process. In addition to that, given that now we have an income eligibility expansion, there's some estimates that about 50,000 new children who are between the income brackets of 250 and 300% above the federal poverty line will be covered now. And the family income ranges from $55,000 to $60,000 for a family of 4. So obviously this will help a lot of the what we call potentially middle-class families. So how much did we get? So there's different estimates. In the first year, California is going to get about $20 million for this program, and obviously that will help our general funds. And that includes about $3 million for medical, which potentially will benefit a pregnant woman. And over the 5 years, we're going to get about $110 million. And that's the breakdown there. The other thing that is not mentioned here is that this new law also not only will increase the amount of money available for children's health coverage, but this also established a new way to better target the money. In previous years, the state had about 3 years to expend any money that was given to cover kids. States now have 2 years to expend any money that we're going to have in California. If they don't spend the money that the federal government is going to give them, then that money is going to go towards a pot of money that the federal government is going to have, and that money is going to be redistributed among other states. And so we have 2 years to spend that money that we're going to get. Any questions? And also, as a background, many organizations that were fighting for this initiative were the the National Immigration Law Center, Family USA, the HUNTER campaign, as well as, to a certain extent, the California immigrant policies, and some of their websites are listed here for further information. And if you have any questions, I'll be in the back. And that's it. Thank you.